Students, I just wanted to go over briefly how to fill out this nursing priority interventions form. So the first thing you're going to do is say, what is your patient's primary problem? What is the thing that's going on today? So if they're here with pneumonia and that's their primary problem, then you would write pneumonia here. If they're here with pneumonia, but now they're withdrawing from alcohol, or now they're in AFib with RVR and they're really sick from that, then that would be their primary problem. So it's whatever is the focus of the day. Okay, so you can use any source you want if you have a nursing care plan book, if you have access to Lippincott Advisor. I'm going to show you how to use Nurse Labs because it's free and it's easy to get to. So you're just going to go to nurselabs.com, and right here at the top, it says care plans. And you can search any way we want. You can also do a Google search for nursing care plans if you know the primary problem that you are that you address to that day with your patient. Okay, so I'm going to go down. So we said this patient today, their primary problem is pneumonia. So I'm going to come to respiratory and look to see if they have a pneumonia care plan, and they do. So I'm going to come right here to this. Now, when you come to this page, I mean, you can see over here, I'm going to make you nauseous for a second. Sorry. I mean, everything is right here on the page, but right at the top that you can always come back to is the table of contents. So when you look at our what we've created here at the school, HCC we're using, excuse me, then we have nursing priority. What are you most concerned about with your patient underneath the heading of here, pneumonia? And then what is the expected outcome, nursing interventions and rationale. Now, when I look at different nursing care plan books, these might be set up differently. So here in Nursing Labs, they have this nursing problem priorities, but I wouldn't click on that because there was literally only four things in there and it's not going to give you the information you need. I want you, if you're using this, to come right down here to nursing interventions and rationales. Because right here is going to give you just a ton of options that might be specific to your patient. Again, this is supposed to be specific to your patient. And what your patient needs might not be in here. There may be other things. But you can just look through here. So my patient's here with pneumonia. Are they somebody who is having a hard time clearing all that sputum? Do they have a low oxygen level? Are they at risk for sepsis or another exasperated infection? Are they having pain from coughing so much? Are they having chest pain? Are they not able to sleep and they're having reduced activity intolerance? Do they have a fever? Are they not eating as well? Do they need education? So just look through here and see what is specific to your patient, and then you can click on it to find out. So say my patient has been here for a couple of days and they're just not eating anything. So that is what I would have been working on that day. So when I come here, and so in here I would just say yeah, pneumonia. So nutrition, my priority is nutrition, and my expected outcome is that the patient will maintain adequate nutrition needed for healing during the acute phase of illness. You don't have to say all that. You can say maintain adequate nutrition. Um, and then when I come back, I'm going to say, okay, what are my interventions? I know my patient needs food for healing, especially when they're in this increased metabolic state. So, there's expected outcomes here you could look at. And then these right here, these are your interventions. So I'm going to monitor the vital signs. Why? Because I know if they have a fever, they have increased metabolic rate and need more calories and protein. Assess skin turgor, and that's going to tell me if they are getting adequate volume of fluid. Investigate nausea or vomiting, because if they're nauseous, it's going to reduce their oral intake. They're not going to take in as much food. Monitor the I&O and weight so I understand what's going on. Well, we're not going to force fluids. We might encourage fluids if they're not drinking enough because we know that they are going to be losing non-sensible losses if they have a fever. We're going to give meds as indicated, like anti-fever meds, anti-nausea meds, provide supplemental IV if necessary. And you can just go through all these. We're going to schedule respiratory treatments an hour before meals because we know those could make them nauseous. So we want to have them separated from the meal. Give adequate nutrition. Obviously, limit milk because that could make them increased production of sputum. Keep their head and neck elevated, monitor bowel sounds, small frequent meals, and give patient choices because we know that will increase how much they're able to eat. Let's see, weigh patient, monitor vital signs. I'll encourage frequent oral hygiene because you know if you're not brushing your teeth, that really does decrease your appetite. So just go through and read all these. Now, what is specific to your patient? That's what you want to and you may have other things that are not on this list either, but you want to put what is specific to your patient. So for my patient, I want to offer small frequent meals because they're not eat as much. And I know that I'm going to do that because they're more likely to eat foods that they like. If I put a plate in front of them with a bunch of food they don't like, they're not going to eat it. Small and frequent because they're tired, and then it just increases their calories that way. I'm going to provide oral care because I know that poor hygiene decreases the appetite. I'm going to monitor their food because I want to see if they're eating enough. So I'm going to stay closer on top of that just to ensure that they're getting enough. And I'm going to educate the patient about calorie and protein needs for healing, that they actually need more. And that's because I want them to be able to make an informed decision about what they're taking in. Okay, so let's say the other one is oxygenation. So let's say they also have a low oxygen level. So I'm just going to come right up here. So let's see, I can look at impaired gas exchange. My expected outcome would be just that they maintain adequate SpO2 above 90% without increased work of breathing, right? Because 90% oxygen with a respiration rate of 28 is you're maintaining it, but you're not going to be able to maintain it at that rate forever. You need to be passively able to get your oxygen in. So I'm going to assess the respirations. I'm going to observe the skin. I can assess mental status. So just same thing. I'm going to come through and read all of these. And then what is specific to my patient? What am I going to do for this patient that I had? So I'm going to frequently monitor respiration rate, SpO2, and work of breathing because I want to notice symptoms early. If they're having increased problems with breathing, I want to give them extra oxygen, have them sitting up, whatever it is, so that they're not getting sicker. I'm going to teach breathing exercises, cough and deep breathe, incentive spirometry or step breathing. And this is to kind of expand their lungs, really get those alveoli open, increase gas exchange, and reduce risk of collapse. I'm going to apply supplemental oxygen as needed. Again, just to maintain organ and tissue perfusion. And I'm going to monitor for changes of level of consciousness or increased anxiety because I know that these are early symptoms of respiratory distress. And then you would just, whatever your third one is. Okay, that's it. I hope you found that helpful. Let me know if you have any questions. Oh, how do I end this meeting? There we go.